There are more serious implications to having a crush as a medical diagnosis than getting your heart broken. Crush injuries occur when a part of the body is squeezed between two heavy objects or experiences prolonged heavy compression, damaging the soft tissues, muscles, and nerves. And as you can imagine, a workplace setting is where many of these traumatic crush injuries occur. What happens to the body to make crush injuries dangerous and life-threatening? And what are the benefits of emergency physicians, orthopedic surgeons, workers' compensation case managers, and others utilizing hyperbaric oxygen therapy to help restore blood supply to a crushed extremity? Hi, I'm Regan Holliday, president of HYOX Medical Treatment Center, located in Atlanta, Georgia. HYOX specializes in undersea and hyperbaric medicine. Our double-board certified physicians deliver hyperbaric oxygen therapy to advance healing naturally and non-invasively. Before HYOX's medical director, Dr. King, joins us to discuss crush injury cases we've treated over the years with hyperbaric oxygen therapy, let's uncover what makes crush injuries so dangerous to life and limb. When an arm or leg is compressed or squeezed with such force, circulation and blood supply is completely blocked. There is loss of life-giving blood to the cells and tissues in these direct traumatic tissue injuries. Acute compartment syndrome often occurs as a complication from the crush injury, causing increased pressure in a muscle compartment. Without intervention and lack of blood flow, permanent muscle and nerve damage, loss of limb function leading to amputation, and other complications may occur. At HYOX, we're grateful to have Metro Atlanta area emergency physicians, orthopedic surgeons, and workers' compensation case managers who understand the gravity of the injury and partner with us to help salvage the crushed limb. Referring to hyperbaric oxygen therapy as soon as possible post-crush injury helps patients regain limb function to reduce complications, hospitalizations, overall healthcare costs, and return to work time. Physician partners and case managers understand the benefits of hyperbaric oxygen therapy to reduce inflammation, create new pathways for blood flow to regain adequate oxygen levels, and prevent inflammatory response called reperfusion injury when blood supply is returned. HYOX Medical Director Dr. Richard King became board certified in undersea and hyperbaric medicine to help these complex cases. He studied medicine at Emory and joined the Air Force to help pay for his education. As a flight surgeon, Dr. King first learned about the healing benefits of hyperbaric oxygen therapy. After he got out of the military, he ran physical medicine and rehabilitation facilities in Florida and Georgia. After years spent rehabbing patients who had undergone life-altering and financially devastating complications and amputations, he decided to shift his focus from rehabilitation to prevention. He and his wife opened HYOX in 1999 to specialize in evidence-based hyperbaric medicine to prevent amputations and heal complications before it was too late. As a rehab doctor, he treated patients who didn't have the advantage of receiving adjunctive hyperbaric oxygen therapy in combination with surgical intervention, wound care, and antibiotic therapy. He changed the narrative by offering hyperbaric medicine in the Metro Atlanta area. Now let's hear from Dr. King to learn about the healing progression of crush injury cases.
This is a 20-year-old patient who experienced a forklift injury at work. It bucked him off of the forklift and then it ran over his pelvis and his left leg, causing compartment syndromes in the upper and lower portion of the extremity. He ended up needing tibial pedal bypass and arthrectomy. He also had to have fasciotomies for the next 2 to 3 days of that lower extremity and buttocks region. The patient was noted to have the 5 P's when you're having a crush injury, such as pain, which he would still have, pallor, there wasn't good blood flow down there, pins and needles, and then other areas where he didn't feel anything, others where he had extreme pain. It was pulseless, and he had decreased range of motion of the ankle and unable to move it. So paralysis, the 5 Ps. So when we saw him, he was having difficulty with healing the wounds that had occurred, especially over the fasciotomy sites on the lateral thigh and on the lower extremity. He was treated with continued IV antibiotics and hyperbaric oxygen therapy, which allowed these wounds to start to close in. He continued to improve and was able to ambulate with a shoe and no assistive device. He was using an AFO for increased mobility and heel strike and toe off to assist with his gait because he had lost motion in the ankle, but had regained it in his knee and hip, which was very important in ambulation and allowing him to walk without a crutch or a cane.
Our next case is a crush injury that happened to a 50-year-old male at work while he was disconnecting a tractor's front-loading basket.
They were looking at the front end loader and they were taking the bucket off. It fell and hit him right behind where steel toes were across the foot. He went to the emergency room immediately. They had him follow up with vascular surgery and with orthopedics. Unfortunately, vascular surgery didn't get to see him soon. The orthopedist told him that he needed his foot cut off, or at least halfway, and the patient sought a second opinion, and the podiatrist also told him he needed his foot cut halfway across. He wasn't real enthused with that idea, talked with his adjuster. She recommended hyperbaric oxygen, and then 3 weeks later we see him with basically ischemic, almost mummified toes. And as we went through, his pain got much better under control. The patient was able to start to ambulate short distances. He was able to go and have the foot surgeon here work with him, and he was pleased with the way everything was healing up and was able to salvage most of his. He did lose portions of the second and third toe, but was able to salvage most of his foot. He was able to go back to work. He doesn't have pain in the foot now, but he's quite pleased compared to where he was going to be had he not received hyperbaric oxygen.
The capacity to heal or to cause more harm is in the balance for patients with crush injuries. The timeliness of the referral is critical to getting the best result. As you've learned, hyperbaric oxygen therapy is an effective treatment to advance healing, help salvage a limb, preserve post-surgical skin grafts or flaps from failing, and resolve any progressing infection that may occur at the injured site. For more information about crush injuries and other conditions hyperbaric oxygen therapy treats, visit hyox.com. And please drop any questions in the comments below. We'd love to respond and even feature a viewer question in an upcoming video. Thanks for watching.